The Center for Individualized Medicine, Story by Story, a video series on topics in individualized medicine at Mayo Clinic.
Today we're in the Gonda building for Story by Story, where I'll go with Dr. Martha Grogan and Katie Agre, and we'll talk about genetics and heart disease in women. There they are. Thanks for joining me in the Gonda building today, Dr. Grogan and Katie. Tell me a little bit about genomics and how that interacts with heart disease and the impact it has on heart disease.
Well, it's so important because we're finding out now that there are a lot of inherited heart disease. So we think of diseases that are what we call acquired, that people get that are not necessarily inherited, but there are a lot of inherited conditions that lead to heart disease, and important for people to be aware of their own risk.
Katie, from the genetic counselor standpoint, you work with patients and their genetic history and family history often. How does that work with cardiac disease?
Often we see patients who are referred for a personal diagnosis, whether that's heart disease itself, whether it's a cardiomyopathy, an arrhythmia, even amyloidosis. But it also is important to recognize family history in the scope of things of people who have family history of family members who pass away really suddenly, or family histories of other cardiac diseases. And that's something we talk about in terms of kind of how genetic testing could play a role in their future health.
And Dr. Grogan, Katie mentioned amyloidosis. You work with cardiac amyloidosis. Can you tell me a little bit about the familial aspect of that?
Sure. So amyloidosis is a disorder of proteins. So we all have proteins in our body that are circulating around doing various functions. And in amyloidosis, the proteins become unstable. They do what we call misfold, and then they deposit in the organs and tissues of the body. And in hereditary amyloidosis, a person has inherited a mutation, a susceptibility to this disease. So this is a very rare heart disease, but important for people to recognize. And if you don't look into your family history, you'll never know which things you're going to be at risk for.
Right, and it never hurts to check into it, right? You would hate to miss it and then not think of it later for family members.
There are a lot of more common conditions that, again, people often don't even recognize that they're aware of. So although we know about heart attacks that are often due to high blood pressure, smoking, diabetes, some families have a higher risk of having heart attacks or having high cholesterol. Some families inherit abnormal heart valves, bicuspid aortic valves. Hypertrophic cardiomyopathy is a thickening of the heart muscle that's actually relatively common. Marfan syndrome. So there are a lot of different things that can cause heart disease. So we encourage people to really look into their history.
I appreciate that. And because it is Heart Health Month, and specifically Wear Red Day and women's heart health is an important part of that, can you tell me what should we be aware of as women with potential heart disease issues?
First of all, women need to realize that heart disease is the #1 killer of both men and women. And even recent studies show that a lot of women don't realize that. So women are so busy taking care of their family members, their friends, they often overlook the symptoms even when they are having symptoms that they would have told their husband or someone else to go to the emergency room for. So recognizing that women can have more atypical symptoms. And then the other thing is that women are kind of often what I call the healthcare executive for their families, and they are the ones getting the information, scheduling the appointments, and that's where women can play a really important role, not only in prevention by heart healthy lifestyles in themselves, their children, eating and cooking right, getting enough exercise, but also in knowing these family history details.
Right, that's certainly important. Well, thank you for joining me. I'm going to hop off on the next floor here.
Okay.
Thank you.
The Center for Individualized Medicine, Story by Story, Mayo Clinic's elevator ride through patient care, education, and research.